All right, so today we are dissolving this patient's lip filler. So I wanted to show you the areas that she's mainly concerned about. So you can see her upper right lip, she has some filler that's sort of migrated to the inner part of her lip, sort of just past that wet dry. She also has a little bit on the bottom, which she wasn't even aware of, but when I flipped her bottom lip out, you can sort of see this like ridge. I don't know if you can see it that great on the camera. So we've just decided we're just gonna dissolve everything and just sort of start from scratch. So we'll sort of start with these inner areas and then work our way out. So she's been numbed for the past 10 minutes with a topical anesthesia, and I'm coming back now with my Hylenex. I've drawn it into a 0.3 cc Comfortox syringe. That way it's just really a nice, sharp, small needle. And I'm literally going right into that area and injecting. We'll give her a nice, really good massage when we're done, just to make sure we're really integrating that Hylenex into the tissue. So you can see I've literally just targeted this one area first. Doing okay?
Mm-hmm.
This is pretty uncomfortable for patients, so just make sure they're good and numb because it burns. That acid burns when it goes in. Let's look at her left upper. So she has a tiny bit that migrated in through here. Doing okay?
I literally don't feel it at all.
Oh, really?
At all.
Oh, wow. Okay, great. So she's pretty comfortable. That's a good thing.
Super numb.
So I'm just sort of giving a nice massage just to make sure we're going to target all those areas. Let's see here. So she's obviously swollen, but a lot of times you can see sort of like immediate improvement. So I'm just going in and just sort of fanning this Vitreous or hyaluronidase, excuse me, Hylenex into her lip tissue. And she's gonna swell a lot, that we expect. Obviously making sure that when you're doing this for your patients, they've got nothing special going on in the next couple of weeks because they're gonna be pretty swollen and bruised. For her, because she's had migration, I'm probably gonna recommend waiting a couple of weeks before we decide to refill her. Sometimes patients need more than one dissolving session too. So we'll probably take a look at her in about a week and reevaluate and see if any more is needed. If so, we'll dissolve then and then give her a couple weeks after then. What happens when this filler migrates is it sort of takes a different channel, and we want to make sure that all those channels sort of close up in the lip before we refill them. Otherwise, the new filler is just going to follow the same exact path that the old filler did too. So that's why we like to give them a couple weeks time in between to avoid it from occurring again. Okay. And now I'm just going to give her a little massage. Open for me. So just massaging it into her lip tissue, really good there. So if you look, I don't know if you can see the difference, but I can definitely see she already has some improvement here along that lower lip where she had that migration. Already she's improved, so that's good. So we'll see her back in a week and then decide from there you know, if we think that the one time did it or if she needs one more session to dissolve.